Alrighty, so we're going to start with some just self-introductions of those of you on the panel. And Carina, do you want to start us out by introducing yourself?
Yes, thank you, Sarah. So good afternoon, everyone. My name is Carina Baca. I am a junior at the University of Verne. I'm a double major in psychology and creative writing, and I'm happy to be here.
Thank you, Carina. Thanks for joining. Jamie Solis, do you want to go ahead?
Sure. Hi, everyone. I'm Jamie Solis. I am the new Health Center Director. I am a registered nurse. I'm happy to be here. Thank you.
Great. Dr. Sanchez-Castro.
Hello, I'm Dr. Sanchez-Castro, and I'm one of the physicians at the University Health Center, and I'm very glad to be here today and to answer any questions you might have.
Great. And then finally, Alison Vicroy.
Hello, everyone. I'm Alison Vicroy. I am the Assistant General Counsel and the Director of Student Civil Rights in Title IX. But the reason I'm here with you all today is I'm also the COVID-19 Compliance Officer for the university. Just to give you just a little background there, that's not a position that would normally be held by one of your staff attorneys. But in a previous life, I was an infectious disease epidemiologist, and I wrote the novel coronavirus or SARS-like disease protocols for West Texas before transitioning to the study of law. So this experience has been a bit of a throwback for me, but I'm able to bring some of that history with us to serve the school now.
We didn't know we were getting so lucky bringing Alison Vicroy onto the team at University of La Verne. I'm sorry that we've needed those skills of yours, but I'm happy that you've been here. And everyone, I'm Sarah Rodman Alvarez, and I direct the Randall Lewis Center for Wellbeing and Research at University of La Verne. So hopefully by now you're seeing that our panel here today is comprised of really key individuals who you can go to with questions within our university around the COVID vaccine and COVID in general. All right, we're going to get started on some prepared questions, and we're going to start out with Carina Baca. So Carina, you're a student, you've been vaccinated. Can you tell us a little bit about what made you decide to get vaccinated and why that was important to you?
Of course. So I'm actually a resident assistant, so RA on campus, and I thought it's just for the safety of everyone too. That's what made me get vaccinated. I think also, it's like a preventive option. So I think that just a vaccination in general was very important for me to do, and just for the safety of others, because I am on campus with other students. So that's why it is very important for me to keep myself healthy and the people around me healthy as well.
Thank you for being so mindful about the community's health. Has your life changed at all since getting the vaccine?
I would say I just feel more comfortable. I feel like I am safer and I am healthier when it comes to being exposed. And I still take the preventative measures. So I do wear my mask still and all of that, but I feel a little bit more comfortable just knowing that I have the vaccine. I am fully vaccinated, and yeah, I just feel more comfortable. Other than that, I feel the same, but I definitely feel like after getting vaccinated, I feel safer and just more comfortable doing my job and, being around campus too, doing tours and being an RA.
That's great. I feel the same. And we're going to get a chance to hear from Carina throughout the panel today. So thank you so much, Carina. We're going to turn to Dr. Sanchez-Castro. So many people are still concerned, and you're even seeing, in the chat today about the safety of the vaccines. What would you say to those of us who might be worried about vaccine safety?
Yeah, I definitely think that vaccines are such a crucial part to preventative healthcare and just healthcare in general for the community. And so when we're talking about the COVID vaccine specifically, we've already had many, many decades and even hundreds of years of studying vaccines. So now we're at a point where we really know how to hone into the way that we perform clinical trials for vaccines. And so many, like tens of thousands of people participated in vaccinations as part of investigations of the COVID vaccines, or the different types, of 3 different types even. And all of them were, I mean, the effectiveness, especially of the mRNA vaccines or just the COVID vaccines in general, are so high compared to other vaccines that we have had in the past, close to 95% even, for the Pfizer and Moderna vaccines. And even the Johnson & Johnson vaccine is a little closer to maybe 60 to 85%, which is still really, really good. When we think about like the flu vaccine, which is 50 to 60%. So the way that we studied them was very vigorous, and the way that we monitor, for possible side effects is very rigorous. So I think that at the point where we have vaccinated at this point, we've given out almost 230 million COVID vaccines, which is really, really great. And when you look across the board, it's so well tolerated. We have our basic things like anaphylaxis, which you can get from any medicine or treatment, so rare. But we have so many people that have received it and have done really well. And there's really no reason not to, unless you've had anaphylaxis to COVID vaccine, pretty much.
Thank you. Yeah, the numbers give me a lot of faith as well, because at this point it is, as you said, hundreds of millions of people, which is pretty incredible. So one frequent concern that I've heard is that the vaccines impact pregnancy and or fertility. Can you speak a little bit to that?
Yeah, I think it's really important to note, and sometimes people are surprised by statistics that we give, which is even from any fertilized egg implantation, maybe 50% will be miscarried. And even before we know that we are pregnant. And so miscarriages and problems in pregnancy are really, really common. And so moving to vaccines, from what the evidence shows, first of all, there's no links at all to any infertility problems or pregnancy problems. And lots of pregnant people have been vaccinated without problem and have been vaccinated and moved on to become pregnant. And so there's really no data or evidence to support that. And there's also no mechanism to support that as well. As a scientist, we like to think about, well, possibly how could we potentially link these problems to a vaccine? And the mechanism just isn't there. And so for both of those reasons, I think we can safely say that there's no connection.
Thank you so much. What happened with the Johnson & Johnson vaccine? Why did we have this kind of big pause in that vaccine and then we restarted? I know it's causing people some concern and they're wary now to get the J&J vaccine. What happened there?
Yeah, that's a really good question. All of us are very interested in the data and the numbers and the specific cases, and trying to read as much as possible. Like since the beginning of the pandemic, we're like constantly reading new updates. But I was kind of obviously taken aback to be like, oh my gosh, what's happening? But at the same time, very relieved to know that they are watching very, very closely. I mean, the fact that they took it off as soon as they thought there was a problem is reassuring. And when they saw, they kind of noticed by number 6 of these very, very rare blood clots. So what they're calling thrombosis with thrombocytopenia syndrome. It can happen in the general population, but when it happens within a couple of weeks after the Johnson & Johnson vaccine, they became very concerned and they halted the vaccine for, about 10 days or so. so that they can really look at the data and try to figure out what's going on with this, why is this happening, and what should we do about it, right? And so the data showed that basically this was happening in women of reproductive age. So women between 18 and 50 was pretty much where they found these isolated cases. And so by looking through all the data and evidence, they found that basically they kind of go through data with regards to the vaccine itself, like what are the benefits of the vaccine and what are the risks or the downfalls. And so they found that if they pulled the vaccine, then we may have more deaths from COVID itself versus these very, very rare blood clots. And so they thought that, well, we want to have multiple options for people. So like you can have more available vaccinations, less deaths from COVID. And if we can put a warning and let every single person know, hey, this potentially is a risk factor, although extremely rare. Like it was when they first noticed 6 cases among 7 million doses. So, and we're still working on trying to figure out the mechanism of that, but trying to weigh the risk and the benefits and saying, hey, in terms of women between 18 and 50, there are other options, but let's not limit our ability to get out of the pandemic and vaccinate those people that are not in that high risk category.
Yeah, thank you so much. That 6 in 7 or so million people, I think, is so important to keep in mind, right? When you really break that down. That's great. What is the difference? I've heard you say mRNA vaccine. We've been talking about Johnson & Johnson. What's the difference between the vaccine, and would you qualify, one as better than others? Should people be picky about their vaccines?
Yeah, that's a good question. We definitely don't really want people to be picky about it. Really, it should be the vaccine you can get the soonest, right? The sooner we can all get vaccinated, the sooner we can get out of this pandemic and getting into like normal social life and interacting safely with everyone. But yeah, the messenger RNA vaccines, which are the Pfizer and the Moderna, are newer. We've been studying them for a while, like almost a decade, but this is the first time we're really having a major vaccine with this type. And so that one, it basically delivers like a code so that your body can make the protein that is similar to the COVID spike protein, surface protein, not the virus itself, not going to give COVID, nothing like that, to trigger your body's immune response, right? Which is what all the side effects we can talk about later, but it's really just your immune system. And that's the mRNA vaccines. Now, the Johnson & Johnson vaccine is more of a typical or traditional vaccine, which we've known and used for long periods of time, which is more of a viral vector. So they take some very insignificant virus and they inactivate it, and they use that to kind of deliver the similar information, so your body will make the protein and then develop the immune response. So they work a little bit differently, but they're pretty similar. And so they're both very, very effective when it comes to vaccinations, just with history of vaccines. And other than the warning associated with the Johnson & Johnson, right? If you're outside of that high risk category, we really want to emphasize, Johnson & Johnson benefit 1 shot versus the messenger RNA, which is 2 shots. We pretty much want to get as many as we can as soon as possible.
Yeah, thank you so much. Should people do anything to prepare themselves for getting the vaccine ahead of time, or sort of preparing for what's to come after?
Yeah, another good question. So not, not really in terms of before. So it's not recommended to take any like Tylenol or Motrin or antihistamine even in preparation. But the one thing I would say is to definitely expect a sore arm. That is pretty much across the board. Expect that. And what I would recommend is, afterward, a cold pack, or, just to kind of to help cool the arm so that you don't have any, so it's not as uncomfortable, and moving the arm as much as you can earlier is the best. But otherwise, we've been training these vaccine centers to carry all their appropriate tools, and you're going to be monitored for anywhere from 15 to 30 minutes to make sure you don't have any reaction. But otherwise, it's pretty common, as we were discussing before, to have a day or so of body aches, even fever, soreness, just to not feel very well. But that definitely goes away very quickly and should not cause any other complications.
Okay, yeah, that's great. But before the panel got started, we were sort of having a conversation about, and Jamie, maybe you can speak to what you were saying earlier a little later, but something along the lines of, it's one day out of one's life to kind of feel not the best, as opposed to getting COVID. So I think being prepared that you will possibly have a day or so of not feeling well is great, but to really keep it in perspective of what the worst scenario could be. So this is our last question for you, Dr. Sanchez-Castro. Are there places people should or should not be getting their information about the vaccine? There's so much misinformation out there.
I agree. It's been very difficult for us as providers and clinicians to try to be, fielding all of these questions from patients, from family members. And ultimately, especially over the past few months or so, it's been really helpful to just go directly to the CDC's website. They have so much information on COVID, on vaccinations, on home care, on what to expect, links to reputable sites. And of course, the Department of Health and things like that. But ultimately, I would say CDC is a really good source. And we have to be really careful with social media or blogs, or even people who claim to have like these titles and they're, giving information, and always look up what, if you think something sounds new or different, try to find out if this is true. Go to a reputable source, which typically is like an academic center or the CDC, something like that.
Thank you so much. Yeah, I think especially after this past year, it's been such a sort of, rightly so, a fearful year, and we've just been in something so unprecedented. And I think it's so easy, because we're already sort of primed for fear, to hear something from a source and have that, totally kind of spin out societally or just internally in terms of what our worst case scenario might be. So thank you so much, Carina. I'm going to turn back to you with a couple questions. Did you have any concerns about the safety of the vaccine before you got it?
Yeah, I can definitely say it's a very normal response. And for me, I think I kind of, it's hard to stray away from what you see on social media, because you're on social media every day. And I think one of the things that you have to make sure to do is to get your resource, your information from scholarly articles or just reliable sources, and not just what you see on social media. And I think that that's where my concern kind of came from all the different information that was put on the internet. And I think it was a very normal response, but like Dr. Sanchez-Castro actually touched on this about vaccines being around for a while. So it kind of did take a few reflections. And since vaccines have been around, there are doctors and professionals that work on this. So that definitely made me feel a little bit more comfortable with the concept of the vaccine. And although COVID-19 is relatively new and the pandemic is new to all of us, it does bring those concerns with it, but just making sure that you're being just wary of where you're getting the information, and just informing yourself is very important when it comes to being comfortable with the vaccine and learning more about it.
Thank you for that. Did you experience any side effects of the vaccine?
Yeah, they were very minor, and like a lot of you have said, they lasted for a day. It lasted just for a few hours, and usually I got my vaccine in the morning, so I would feel a little bit arm soreness by the end of the day, or a little bit of muscle soreness and a minor headache, and it just lasted for a day. Besides that, I felt completely fine, completely healthy.
Okay, great. What do you think other students should know in preparing themselves to get the vaccine?
Yeah, so definitely make sure that if you have any questions, if you have any concerns about your health or getting the vaccine, definitely talk to your health provider, talk to someone that you can trust, informing you about it. And like, I think, Dr. Sanchez also touched on this. Don't rely on social media or other resources to get your information. I think that as long as you're getting educated and know more about it, it will make you feel more comfortable. And yeah, so I feel like those are the only steps that I would recommend.
Thank you so much. I think something that's great about social media is it does allow for the spread of information faster and to people who might not be on the CDC website, et cetera. But that, like you're saying, and like Dr. Sanchez-Castro is saying, you really have to look into it and back it up. So if you hear something, then you do your due diligence of looking back into that, right? Thank you so much, Carina. Alison, I'm going to turn to you. So what safety precautions will the university be taking as we return to, yay, face-to-face learning this fall?
We have been putting in a ton of work for a full year now. I can tell you that the day we went home, or when we started working and learning remotely, that next day we began building the framework that would support us as we return. A lot of what we are planning on for returning in person is already in place, because we have had some people on campus. We had students in the residence halls. We had a couple of academic programs that were permitted by the state restrictions to be on campus. And we had some essential employees who needed to come to campus to do their job to make sure that we could continue serving our students. So some of those interventions that we've had in place this whole time, we have an extremely robust case response protocol. So we're really doing things just like the health department would do them, but we're doing them faster. So we are doing contact tracing, where I am personally calling every single person who has symptoms, who tests positive, walking them through what isolation is going to look like, and kind of explaining our protocol, doing the contact tracing to determine who may have been exposed, and then calling all of those individuals on campus. We've been extremely lucky that we weathered this storm pretty well. We had some people get sick, but on the whole, we were able to control the spread on campus, even through the hardest parts, the post-Thanksgiving, post-Christmas time periods were really tough, and we did a really great job. We had, part of that process is we've had a really robust surveillance testing program in place. We also are doing testing whenever someone is a contact, whenever someone has symptoms, and that's something that Jamie, coming in as our new director of the Health Center, has been amazing to really enhance that protocol. And we have some really new, exciting opportunities in that surveillance testing area that we're looking forward to putting into place soon. And also, again, because of the addition of Jamie, we have some new potentials for partnerships for providing our population access to vaccinations. A lot of the employees were able to go just kind of down the street to Western and get our vaccines. That's something that was a really incredible opportunity that a lot of similar schools did not have. They're scrambling trying to get those doses. So we're going to have all of that in place. On top of that, we're doing a really, really strong push on environmental enhancements. I see one of my colleagues on the call who is leading the way on this. Jason Miller is a superhero. He's our AVP of facilities and other areas of campus also, and has undertaken making our buildings, making our spaces safe for people. That includes upgrades to our HVAC systems. We also have enhanced cleaning protocols that are following the science on how this disease spreads. We have masks, PPE, hand sanitizer stations. We have all of those things that we're going to need when we're on campus to keep ourselves safe. And then finally, just the policies. We are implementing evidence-based policies, and that means they do change. As we learn, as the CDC comes out with new guidance and that gets incorporated at the state and then at the county, we're putting those best practices into place and informing our policies. So you can see a lot of that reflected in our safe return plan. It includes all the requirements that we have from the state or the county, but it goes above and beyond that to keep our community safe. So I think a lot of those things, a lot more things are in place to try to keep everyone safe when we get on campus, but also understanding that things are fluid. We don't know what 3 months is going to look like, and we're going to be proactive, but we're also going to understand we need to take the precautions as the current circumstances dictate.
Yeah, it's not easy. It seems like a moving target constantly the past couple of years, but thank you so much for all the work you're doing, and Jason and Jamie and Dr. Sanchez-Castro, just everyone who's been has spent so many hours trying to keep the university safe and understand the best way to sort of come back face to face. So appreciate you. How does being vaccinated change what you do or do not have to do on campus?
Yeah, so it's important to remember that even individuals who are fully vaccinated still have to follow the safety protocols on campus. So we're gonna have, the evidence says we gotta have protocols related to mask wearing and social distancing and reducing, de-densifying or reducing the amount of people in any given space. But there are things on campus that it really is a benefit to be vaccinated. That you you and your contacts, you're now safer. That's probably the biggest one, and I don't want to gloss over that your personal health is at the fore. But functionally, isolation and quarantine. It's a different situation. If you are fully vaccinated, and generally speaking, if you're exposed to someone who is who tests positive and you're not having any symptoms, you don't have to quarantine. I can tell you, I've been on the phone with those students when I delivered the news, especially when it was 14 days in the fall, that you're going to be stuck in this teeny tiny little dorm room and you can't leave, you can't go walk outside, you can't do your laundry, can't go to the grocery store. It's hard. It's really hard. And being vaccinated means that process is not going to happen. With our student athletes, it means that if there's an exposure, they're not going to miss that game or that practice, that team experience. One thing that that a lot of people like is you don't have to do the surveillance testing. That's unpleasant. That is, I have heard that described in numerous colorful terms. It's not something people want to do. You got to take time away from, you got to schedule it around classes. It's just, it's something that if you can get out of it, you want to get out of it. So you don't have to do that once you're fully vaccinated. And we do believe that the health department is likely going to tell us that if we have 2 fully vaccinated students, that they'll be able to live in a double room come the fall, which I know is something that that students are looking forward to.
That's awesome. I think it's so important to remember that life actually does change in many ways once you get a vaccine. I know this is not about campus rules and regulations, but like I've been able to see my mom and I've been able to hug my sister, and just these really basic things that before COVID we took for granted. And because we're both vaccinated, I'm not worried about, risking their lives by just being in the same room as them. And that is a huge, huge difference. So thank you. So actually that was my next question to you. I just gave an example, but how, in your opinion, sort of outside of campus, outside of ULV, does being vaccinated change what you can and can't do, just more generally?
Yeah, that's great. And I totally understand. Some of you may heard us when we were before we began here today, I was sharing with the other panelists, I haven't seen my family for 2.5 years. Now I can only blame a year of that on COVID. I get to see them in 3 weeks. That would not be possible if my entire family was not vaccinated. I wouldn't feel comfortable doing it, not just because of the risk to me and my parents, my husband, but because of my commitment to doing everything that I can to keep my community safe and to enhance the public health. But we are fully vaccinated and we get to see each other. And that's one thing that the CDC has said. They said you can spend time with other people, even people from a couple different households who are fully vaccinated. You can even be inside. You don't have to wear a mask. You don't have social distance. I can hug my mom. That's huge. I think that we understand that the pandemic has taken a toll, not just on our physical health, but on our mental health, and being able to build back some of those relationship connections is going to be so vital for a lot of us. You can also spend time, according to the CDC, indoors without masks, without your distancing, with unvaccinated people from one other household. So you want to remember, though, that anyone who is at risk for severe disease, that's not something that you want to risk with them, because we know it's not 100%. So you want to take precautions there with individuals who might be at a higher risk. You can travel. Air travel, actually pretty darn safe. Enforcement of mask requirements and the air circulation kind of stuff. You won't have to quarantine after that travel. So that's a pretty big thing. My parents are coming from Texas. LA County has some of these most strict travel quarantine requirements in the country. And if you're fully vaccinated, you don't have to do that quarantine. It's kind of a complicated situation if you're not. Honestly, it's hard to do the screening, symptom screening for coming to campus, because that travel quarantine question is so complicated. You can also travel internationally. By and large, you won't have to do a pre-travel test, although some countries do require that. And coming back, you won't have to do a quarantine. And you can do stuff outside without wearing a mask. If you're in a group with a lot of people, you're still gonna wanna wear that mask, but you can kind of feel a sense of normality out and about once you're fully vaccinated outside.
Thank you so much. You're making me feel safer about the air travel. I have my first air travel in over a year coming up, and it's nice to hear it come from your mouth that it's pretty safe these days. So that's wonderful. And for sure, not having to quarantine after you travel is huge, because the amount of time it takes to quarantine is longer than most of us can take to do a trip, right? So it just hasn't been worth it for a long time. So that's great. And then last question for you, Alison, are there any policies that students, or really anyone in the Zoom or watching later, should know about that can support them in taking time off to get the vaccine, like if they were to need that day of rest or whatever?
Absolutely. This is one thing that we are fortunate that the state government has been really invested in supporting workers, in understanding that we are not, our ability to work from home is not evenly distributed. And some people have to go to a physical location. And I know I'm hearing from people that they're a little concerned about the side effects, but on their own, it's like, yeah, I'll feel, not awesome for a day. Their concern is taking time off from work to get the vaccine, or if they have a day of side effects that they wouldn't be able to work. And I want to let you all know that there is a state law that requires certain employees to provide certain employers to provide their employees up to 80 hours of paid sick leave for time lost related to COVID. And that includes a lot of different reasons why you may not be able to come to work related to COVID. But specifically when this law was updated in 2021, they specifically talked about getting your vaccine and vaccine side effects. So all employers are a little bit different. Your situation is different, but it does apply to hourly workers, salaried workers, part-time workers, full-time workers. But it will depend on your specific employment situation and your specific employer. So I'm going to put in the chat an FAQ from the state that'll give you some more information. But that may be a really good resource that will help you go get your vaccine, take a day off if you have some side effects without it impacting you financially with your job. So I will I'll throw that in the chat.
Thank you so much for linking that. That's such important information to have. Carina, briefly back to you. Would you tell us a little bit about sort of the process you went through? Like, how was it to sign up for the vaccine? Where did you sign up? And then what was it like to get the vaccine? Just describing that experience.
Yeah, so our university is partnered with Western, and because of that partnership, I was able to get the vaccine. So they sent an email out to students, and it was a quick, easy process where they sent us a link, and that would redirect us to a site where there was different options of just dates and locations to get the vaccine. And because of the partnership, it made the process super simple, super easy. And I think it was within just a few days, I was able to get my first dose of the vaccine. And sorry, I'm reading the questions. So I did get it at Western, which is in Pomona, and it's just a few minutes away from campus. So it's super easy to get there. And there was a line only for the first dose of the vaccine for me, but it was super quick. There was a lot of employees that made it easy to move along with the process, and they were very informative when it came to a checklist of requirements before getting the vaccine. And on the second dose, there was no line. It was super easy, super quick. The whole process was less than an hour. And I would say about 30 minutes, adding the wait time after the vaccine. I think we had to wait 15 minutes there just in case we were feeling a little dizzy or we were feeling a little weak in order to drive back safely. So the whole process was super simple for me. I think the university made it really easy too and accessible for students, which I really appreciated. And I know this is definitely a great benefit for us because not other students get the same opportunity. And yeah, because of this partnership, it was really simple, really easy to obtain.
Thank you so much. I had the opportunity to volunteer at Western for the day, and I was really impressed at how organized they were. And as someone who's not a clinician, I have to say it was really fun to be on the side of kind of hope of getting people vaccinated. It was really wonderful. So I'm glad you took advantage of that. All right, well, now we're actually going to have Jamie Solis walk us through what it's like for a student to sign up for the vaccine, should you want to. So I think she's going to go ahead and share her screen here.
Yes, I'll share my screen now. So currently we have a partnership with Pomona Valley also that we should be sending out to students every Friday. You guys should be getting a link to the days and times that are available at Pomona Valley. So you still go through the myturn.ca.gov process. So I'm going to walk you guys through that so that you can see how simple it is. And then we also created a document for everybody. If you had questions, it's a step-by-step on how to do so. So you're going to just go to myturn.ca.gov, and then it's pretty self-explanatory. You're going to go to the first step. You're going to type in whatever language you prefer. Mine is English. We are going to go to your next step, and you're going to read through the privacy statement. Once you agree to it, check mark. You only have 2 choices of ages because 16 and older are the only eligible group that can get the vaccine. So you choose whatever category you are. And then you want to put what county you're in. So you want to put LA County for the Pomona Valley to populate. And then do you work in a different county? You can answer whatever applies to you. Mine would be no. And then if you need transportation, which would be only for somebody who is in a medical need that would need transportation. And then they want to know if you've had your first dose so that they don't prompt you to sign up for your second dose. So you would say, no, I haven't had my first dose. And then you're also just going to certify again that you're 18 years or older and that everything is correct that you're submitting. You click continue. And then they're going to give you the Johnson & Johnson update because some of the sites have brought back the J&J vaccine. So just so you know, that could be an option. And then you're going to type in your zip code. I just put in the school zip code just to make it simple, but you could put in your own zip code and it would populate whatever vaccination site is near you. But if you want to go to Pomona Valley, I just put in the school zip code. And then it brings you to all these different options, which you can definitely do. But if you scroll, she said, just keep scrolling and you'll get to the Pomona Valley option. And then you go to schedule. And right now they want you to have a scheduled appointment. So you choose whatever day and time works for you. Maybe this is my only option. There we go. So tomorrow I can choose whatever time I want. And then right away, it's going to prompt you for your second dose. So that way, you have that secured appointment. I'll choose. So now I know for sure that on May 6th and May 27th, I have an appointment set up for myself and I'm ready to go. So then from here, I'm just going to put in all my personal information. And then last step, and they're going to ask you, obviously, if you have health coverage, whatever answer it is, do you feel sick? Because they don't want you to show up if you feel sick. Answer all of your personal questions. They're going to always ask you if you've had an allergic reaction in the past. Very important. If you know you've had anaphylaxis to a COVID-19 vaccine, which if it's your first dose, the answer would be no. They're going to ask you if you've had any other vaccines in the last 14 days, and that is important to note. If you had anything else like a hepatitis or a Tdap, something like that, you definitely want to note here if you did in the last 14 days. And just go through all the prompts. They're very, very easy. Click continue, and then you're confirmed. And if you don't want to go to Pomona Valley, you don't have to. You can sign up at whatever local site there is available that's closer to you. So you could put your own zip code in, and there's availability everywhere right now. And a lot of places aren't even requiring an appointment because there's so much vaccine availability out there. So it's very, very easy. And then hopefully in the chat, they'll put the step-by-step guide in there so everybody will be able to see. I'm not going to go to the next step because I don't want to confirm the appointment, but that is the process, which is very, very easy.
Thank you so much. It's really helpful just to see that and see what the website looks like, and just remembering to keep scrolling.
Keep scrolling.
Keep
exactly. And that was what the nurse from Pomona Valley said, is keep scrolling. They have set aside appointment times for us. And every Friday that link should go out for everybody. And if you click on the link, it takes you right to the My Turn webpage, and then you just go through those prompts.
Perfect. And yeah, you can see in the chat, Allison Creek put the steps for a vaccine appointment. So you all can grab that from the chat and download it if you need more. And then Jamie, can you talk a little bit about the CDC cards people get once they're vaccinated? They seem like this almost new passport in life. Is there a way we should be storing them? And do you think those cards are going to be useful now or in the future for anything?
Yeah, I mean, they're definitely going to be useful, right? So that's our proof that we got our vaccination when we had it, because you're not fully vaccinated until that 2 weeks after your second dose, right? So you want to store it like you would any other important document, your birth certificate, your social security card. They recommend that you make a few copies of it, so that way you have it. And you can laminate the copy at Staples right now for free. So through the end of the month, they'll let you laminate that vaccine card for free. So it's important not to do the actual vaccine card, because some of them, the ink is spreading and so you can't see it. So do the copy. So make multiple copies, have that, you know, wherever you need to have them, but keep the original somewhere that, you know, you don't want to misplace or lose.
That's super helpful, because I wouldn't have known sort of about the ink and the original. So
people found that out the hard way. So depending on what kind of ink or whatever was used, they're laminating and it's spreading and it's not legible any longer. So it's very important to keep those copies, because they will be useful in the future, right? If you're coming to school, you need to prove that you've had your vaccine, so that if God forbid you come in contact with somebody with COVID, you might not have to go through the same steps or process that you would if you weren't vaccinated, right? If you want to fly, if you want to do anything, they're going to ask for that proof. It's going to be critical to keep in a safe place.
Yeah, thank you so much. I really appreciate that, and for you walking us through those steps. So I'm not seeing many questions in the chat yet, but if you have any, please go ahead and put them in there so that we have those ready to ask our panelists. But in the meantime, I'm really happy that we have our university chaplain with us, Zandra Wagner, and she's going to briefly share just about a very exciting program that she's working with this summer related to the vaccine.
Thank you, Sarah. So there is a national organization that has millions of dollars that they are using to support college students to go out in their communities to help with education and access for the vaccine. And so we have 11 students at Verne who are taking part in this vaccine ambassador program. And actually 4 of them are here today. And so I'm just going to say their names. They're 4 of the 11. So Karina, who you've all been listening to, she's one of them. And then Isela Chavez, you can wave if you want, Isela, thank you. Stephanie Castro, and then Kimberly Benitez. And they'll be working throughout the summer to help in the communities and also to encourage or answer questions of their peers. So we're so glad they're here. And Carina, if you want to say a sentence about why it is you wanted to be a vaccine ambassador, that would be great.
Yeah, so the vaccine ambassador program was very something that I kind of really wanted to be involved in, because the current issue about getting vaccinated and just COVID-19 is very urgent. And I saw the need in my community and also like within certain groups. So I definitely thought that, you know, being a helping hand in this program was very crucial, especially at this moment. So that is why I am interested and I'm taking part in this program.
Thank you so much, Carina, and thank you, Zandra, and thank you all of the students who are part of that, especially those ones who joined us here today. I hope you found this panel useful in your future work of sort of spreading the word about vaccines. I don't see any questions in the chat, so I guess I will just leave it to the group, the panelists, if you want to say any last words about the vaccine, feel free. And otherwise, we will say goodbye for now. Okay. Well, in the face of just this very horrific and unprecedented pandemic, you know, I know that the vaccine has had a lot of misinformation. I know that people have had difficult side effects they've dealt with, but I, for one, am just extraordinarily appreciative that the vaccine has given us a road out of where we've been. I look very much forward to seeing all of you in person when we come back to campus and enjoying that time in the same space safely. So thank you for taking the time to learn today. And thank you so much to our panelists for taking the time to educate us and serve as a resource. I know, again, that you're all working so hard to make sure our students and our general campus is safe. So I deeply appreciate you. And that's all. I hope you have a wonderful day and Cinco de Mayo, and we'll see you soon.
Thank you.